Are you registered with an NHS dental practice? Well, in fact, there is actually no such thing as being registered with an NHS practice. Since 2006, there were changes to the dental contract and how dentistry is provided under the NHS, and it meant that registrations were no more. So I want to go into an article written by the Guardian, which is looking at making dentistry under the NHS similar how you interact with your GP. My name is Dr. Arnold and I'm a dentist in the UK. Experts sink their teeth into England's NHS dental care crisis, ideas to revive NHS dentistry, including a GP-style right to register, and fewer checkups for those with healthy teeth. Amid renewed concern over the millions of people in England who cannot get NHS dental care, and a warning that the current dental recovery plan will not work, ministers are drawing up their own proposals to tackle what's widely agreed to be a crisis. So there's 4 ideas that have been set out. Let's see what these 4 ideas are. And it's to stop many people that can't, pay for private dentistry, having to undertake DIY dentistry, pulling their teeth out, or doing fillings themselves. So the first idea is a GP-style right to register with an NHS dentist. So it says that patients used to have a right to register with and be treated by an NHS dentist in the same way they could with a GP surgery. That right was removed in 2006. This is when the UDA contract came in. Rather than being paid an agreed sum in lieu of the care they provided when needed to every person registered with them, dentists were now paid by these units of dental activity. So people are also confused about the relationship between an NHS dentist and patients, with many mistakenly believing they can register with a dentist permanently, a right they lost in 2006. We urge the government to base their plans to improve NHS dentistry on the principle of giving people the right to register permanently with a dental practice like they do with an NHS GP. The change in 2006 is a key reason for the loss of general access to NHS dental care, and so it is time to go back to the old system. A little bit of background: in the old system, dentists that were providing care under the NHS system would get paid for each item of treatment that they're providing, for each x-ray, for each filling, each denture. Dentists will get paid for each item they're delivering through the NHS. In 2006, these units of dental activity came in, which meant that treatment was banded. Band 1, band 2, band 3. Now, any treatment that was banded under band 1 would mean that the patient only paid a band 1 charge. Any treatment that was under band 2, including band 1 and 2, you just pay the band 2 charge. And then with band 3, any treatment that you had that included a band 3 item, you just get charged the 1 charge of a band 3 course of treatment. So what this means is, if you needed 1 filling, or if you needed 20 fillings, it would all come under a band 2 charge. So the dentist and the dental practice would get paid the same amount for treating someone for 1 filling compared to treating someone for 20 fillings. They'll get the same amount of remuneration, the same amount of pay. So now this is counterproductive, because if people who need dental care are going to need a lot more treatment, it's going to take a lot longer to treat those individuals. It's going to be the same remuneration as somebody who needs very minimal treatment. So then it means that where dental care is needed is going to be missing out on provision of dentistry, because it just won't be viable to sort out staff wages, bills, and the running of a dental practice if you're getting paid for 20 fillings what you would for 1 filling. The maths just doesn't add up. So point 2 is fewer checkups. So traditionally, dentists have suggested that patients come back every 6 months for a checkup of their teeth and gums. However, a policy analyst says such regular checkups are unnecessary. Interesting coming from someone who's not a clinician. If the gap between appointments was widened to 1 or even 2 years, dentists would have more time to provide more NHS funded care and patients would not suffer, as emerging problems with their teeth would not be missed. Right, so this sounds good at first, because if you're saying that instead of seeing, a patient every 6 months, you're going to see them every 2 years. That's going to open up, a lot more time in the diary to see other patients. But the most concerning thing about this is if we're pushing a lot more people to 2 years before being seen again, a lot can happen with your dentition, with your teeth, with your gums in that 2-year span. Now, there are some people who are very stable and don't need much in terms of routine dental checkups. Yes, you could push them to, 1 year, a year and a half, maybe even 2 years, but, it's very rare that you come across people that are in that sort of situation. For the majority of people, they're going to need to get seen a lot more regularly than on a 2-year basis. So whilst it sounds good, in reality, people do need to get seen regularly and more often than 2 years. Traditionally, NHS dentists have by default asked people to come back for a checkup every 6 months, but a review of the evidence by the expert body found that a gap as long as 2 years was perfectly safe for many adults. So again, this is where you've got to be really careful. Some adults, yes, 2 years might work, but for the majority, I doubt that 2 years would be supported. There's an appalling shortage of dental care, correct, with many people going without NHS checkups at all. NHS England has really started to raise these flexibilities. So even though this sounds like, it could be a good way to free up more time, dentists see more people, I don't think it's going to be very beneficial in that you're just trying to do more with the same amount, same capacity, same amount of dentists, same capacity, which I don't think is going to be a great solution. Really need to be thinking about having more clinicians, utilizing the wider dental team, and giving patients more time to give patients the best outcomes of their dental health. Number 3 is ditch the dental contract. So there's widespread consensus that the current dental contract isn't fit for purpose, agreed. A lot of dentists are moving away from the NHS because of how unfit for purpose the contract is. The BDA, British Dental Association, thinks it's absurd and helpful that under the current contract, an NHS dentist pay the same whether they delivered 3 fillings or 20. This means they're punished for taking on high needs patients. The BDA wanted to see a system that would focus on preventing people's teeth decaying in the first place and give extra support to those with the poorest oral health. That sounds like a much better system that's really going to help people for the long term. Number 4 is to overhaul the funding of NHS dental care. So NHS dental care is so dysfunctional that some of the budget to pay for the care patients receive goes unspent because of the reduction in NHS treatment being provided. Units of dental activity are the main problem. NHS dentists are currently paid for each unit of activity they do, with 1 unit for a checkup, 3 for a filling, and so on. This is very simplistic given how different patients are, and means dentists are penalized for tackling the most difficult problems because they get no money for them. It means dental practices actually lose out on funding if they keep people well so that they don't need treatment. Instead, he suggests dentists should be paid on the basis of a capitation model where they would receive a set sum to cover the cost of treating their local population. That sounds a lot more sensible, a capitation model, as opposed to what's currently happening. The BDA agrees. It says replacing UDAs would help tackle the 21% vacancy rate for dentists in high street practices and help encourage surgeries to know that meaningful change was coming. So we're losing dentists that can offer NHS dentistry. So changing the contract is going to be a big way to retain the NHS dental workforce. So those are the 4 ideas that are being put forward for changing the way dental care can be provided under the NHS. What do you think? Do you think any of those ideas can work? What ideas do you have that you think could work? It'll be interesting to hear your thoughts in the comments section. I'll see you guys in the next video.